Welcome back to Morning Rush on Metro Television. My name is Anaya Tanobwachi. Now, many residents have been affected by the unprecedented flooding, which has caused the AKOSOMBO Dam spillage, and this national disaster has resulted in untold hardship, loss of life, and also loss of properties. Now, the Volta Health Network, an organization which specializes in healthcare in the Volta region, has issued a press statement with regards to the health implications of the AKOSOMBO Dam. And so this morning, joining us on Zoom is SELASIE MortoI, MD, FACC co-president, and also a cardiologist, assistant professor of medicine at the University of Illinois College of Medicine. Good morning and welcome, sir.
Good morning to you. Thanks for having me.
Okay. Can you kindly give us a brief background of your organization?
Yeah, our organization called the Volta Health Network is an organization of healthcare professionals and other individuals who have the healthcare of the people of Volta region at heart. Our organization is, it's a new organization, but we've left a big mark already. We've been able to organize medical missions in the Volta region, which are actually multi-specialty medical missions, where we provide free healthcare to the people of Volta region, ranging across all specialties almost.
Okay. Generally, what do you make of the response of the flood that has been going on from where you are? What have you heard, and what is your reaction on that?
Well, in order to delve into the politics on the ground, I would just say that we have watched with concern the unprecedented disaster that is been occasioned by the spillage of the AKOSOMBO Dam. And you would think that a lot of thought processing should have gone into this, a lot of pre-planning and preparation should have gone into this before the spillage actually occurs. But we are where we are now. Our people are suffering. Their livelihoods have been displaced. Their lives, their properties have been lost. And they have to contend now with the health implications of such a monumental deluge. I would say that the initial response has been tardy and muted, but it is heartening now that the government and the Volta River Authority and other stakeholders are belatedly coming to the aid of the people affected by this monumental flooding disaster.
Okay, so you mentioned some of the harmful substances that will be probably in the water. So let's talk about those diseases and substances that could be in the water that can affect lives in the communities.
Yes, we know this from flooding worldwide, that when you have flooding like this, you're going to have hazardous chemicals, industrial waste, if there are industries over there, household waste, hospital waste, animal and human waste contaminating these waters. And when people get exposed to these waters, they're likely going to suffer some untoward health consequences. These waters also can become breeding grounds for mosquitoes, which we all know causes malaria and other mosquito-borne illnesses.
Okay, Samuel, let's look at the effects. I mean, there's been stagnation. Water has been in so many places, and there's been stagnant water. Let's talk about, since we've mentioned the harmful substances or the harmful diseases, let's look at the effects that can be on the lives of these people.
Yes, you know, when these people get exposed to these waters, which invariably I can see that they've been wading through these waters to reach to their properties. When you wade through these waters, say you have an open wound, you're likely going to suffer bacterial infections, which if you're not lucky can spread and overwhelm your system and may even result in death. They're going to have skin rashes. They may suffer gastrointestinal illnesses, bacterial illnesses like cholera, enteric fever, what we call typhoid fever, and some viral illnesses as well, such as hepatitis A and E, which are transmitted by the fecal oral route. And then again, we talk about mosquitoes, and the risk for transmission of malaria. Also think about when people are in these congregate settings, for example, these camps that have been organized for these people. In these congregate settings, when people are close together like this, they share pathogens among themselves. So you're going to have respiratory illnesses. We all know about the pandemic, COVID, that we're all contending with. And there's going to be a flare-up of all these diseases among the people.
Organization that specializes in healthcare, especially in the Volta region, what are some of the activities you hope to embark on in this crucial moment?
We just, in fact, incidentally, we just finished our major medical mission in Adidoma, which is in the Central Tong constituency. And therefore, we went to Adidoma. We saw the beauty of Adidoma. We saw the people and how nice they were. And we took care of them in all happiness. Only in a few months to hear about this monumental man-caused disaster. And therefore, it breaks our heart. And we stand ready as the Volta Health Network, our group, our members stand ready, our sponsors also stand ready to step in. We can marshal our forces, go there and provide medical services as required. And I think that is in consideration at this point.
Okay, and how long are we looking at for this situation to be solved? From your personal or experience, what looking at how the damage it has caused, can we say that, in the next couple of months, in the next days or two, this situation can actually be resolved?
I am sorry to say this, that I think this is we're in it for the long haul. It's going to take a while for these waters to recede, and some of the properties and lives lost can never be recovered, and people are permanently damaged in most cases. But I hope that the authorities concerned will take remedial measures to help drain the waters, because the stagnating waters is not good for the people, and it leads to breeding of diseases that will affect the healthcare of the people. So for me, as a healthcare professional, and as a layman looking at this, I would say we're in this for the long haul. It's going to take a while for the waters to recede, because it seems that we're relying on nature to do this for us.
And looking at the fact that the rain has been coming down, can we even say that we are looking at nature to actually take care of this situation? Can it be possible? Will the rain stop anytime from now?
That is beyond my expertise. I can predict a lot of things, but I cannot predict the rain patterns in Ghana.
Yeah. Anyways, Samuel, any other thing you'd love to touch on before we wrap up on this conversation?
Yes, I would like to advise the people affected by these floods to be careful of wading through these waters. If they must do that, we advise them to wear personal protective equipment like Wellington boots, gloves, and goggles before they make contact with these waters. And after that, we advise them also to bathe with clean water and soap. Also, if their clothing becomes contaminated with these waters, we also advise them to wash with clean water, soap, preferably hot water. And we advise them to use the same infection control techniques, such as hand washing before you eat. When you shake hands, wash your hands, use hand sanitizers, etc. And use mosquito control measures. I would like to advise the authorities also to put in place mosquito control measures in order to curb the transmission of mosquito-borne illnesses.
Thank you very much, Samuel, for this education. I really appreciate your time. So Samuel SELASIE MORTOI is the MD, FACC co-president of the Volta Health Network, and they issued a statement with regards to the health implication of the AKOSOMBO dam spillage.